All right, good morning, everyone. Thank you for joining us. My name is Nora Rose, and I work here at the El Paso Chamber. Today, I have the pleasure of being joined by Estela Reyes from Centro de Salud Familiar La Fe and Jessica Brito from Centro San Vicente Health Center. Also on the line is Leila Melendez from Workforce Solutions Borderplex. And today, we're going to be discussing community healthcare providers and the COVID-19 pandemic. As a quick note, if this is your first time joining us, we have been hosting other virtual events on various COVID-19 related topics. So I encourage you to visit the video section either on Facebook or on YouTube to see some more of those videos. This event is part of a series that is being sponsored by Workforce Solutions Borderplex that focuses on some of the major updates and sectors and some of the industries in El Paso. And we are also joined on the line by Bill Schlesinger from Project Vida Health Center. So I just wanted to turn it over to our guests to start. If you could please just briefly introduce yourselves and your organizations.
Okay, I'll start. This is Estela Reyes Lopez. I am the Media and Public Information Officer for Centro de Salud Familiar La Fe. We are a federally qualified community health center. We were founded in 1967 here in Segundo Barrio. We have grown tremendously since then. Of course, and with the blessing of the community and the support of the families that we are very proud to serve. We now have clinics and human services sites all throughout El Paso County, stretching all the way from San Elizario, all the way west into the Upper Valley.
Hi, my name is Jessica Brito. I am the Mission Integration Associate for Centro San Vicente. Tell you a little bit about Centro San Vicente and what we do. We provide community-based primary health care services. We're also an advocate for social justice and a voice for the cause of improving health of the medically undeserved.
Leila, are you going to go ahead?
Sure, I'll just really briefly, I'm Leila Melendez. I'm CEO of Workforce Solutions Borderplex.
And I'm Bill Schlesinger, CEO of Project Vida Health Center and co-director of Project Vida. We have a complex of different programs and activities that include primary care, integrated behavioral health, oral health, housing, early childhood development, after-school activities, microenterprise technical assistance, and homeless prevention and recovery.
Okay, well, thank you all for joining us this morning. I was wondering if you guys could just start by talking a little bit about what your organization's experience has been kind of on the ground throughout the COVID-19 pandemic. We can go in the same order. Estela, if you want to kick us off.
I'm sorry, could you repeat that?
Yes, I was just wondering if you could talk a little briefly about what your organization's general experience has been kind of on the ground dealing with this pandemic, since all of you are, community healthcare providers.
Well, right now, like many organizations and health providers throughout the community, we're seeing our community struggle a great deal with lack of guidance and information from statewide. We're, like many other organizations, also struggling with having enough resources, PPE, the personal protective equipment. I think everyone in our community right now is trying to make every day the best that they can with what we have, to make sure that our community feels safe, gets the resources that we have. We here at La Fe are not doing testing to the general public. We are testing for our clients, our registered members. And so that in and of itself is a major struggle. But we are doing it one day at a time, doing the best that we can and moving forward to be able to protect and serve our community.
I agree with Estela here at Centro San Vicente. The experience as a whole was something new, I think, to everyone, something that we've never, gone through before. Lack of PPE was a big one. Thank God, at this point, we were able to move past that. We also had to face reassignments and then learning to operate under this new normal. I think that's been something that we've all had to understand, to educate ourselves. And, I like that you said that, about educating ourselves. That's something very important is our education as a clinic. And we do testing here. We test our patients and we do, take people from the public as well. But it's been hard. It's been hard. Like we've all been saying, it's a different experience. It's a whole new experience, and learning to adapt has been difficult, but we've done it. So that's amazing.
So we set up community testing, drive-through testing in 79905. And we're testing probably about 300 a week, 400 a week. We're a relatively small test site. We've had fairly good luck in partnering with the city and using their GenPath contract, but found a lot of confusion in the process of who's going to pay for it, how it's going to get paid for, and do you collect insurance or not, that sort of thing. And a lot of just panic about people getting tested. The challenge of getting test results back to people has been a real issue, although we've managed probably in the 48 to 72 hour window for most of it. We've got a major shift in terms of people working from home, like me. This is home. And then also adapting entry procedures into our buildings, where people are screened and questioned first. And then you run into situations where people will say what they think they need to say to get past the screener, and then later will disclose that they had an issue. And so we've been very careful to keep our providers in full PPE whenever they're doing patient contact. We do the temperature screening at the doors for what it's worth at this point, knowing that there are a lot of asymptomatic folk out there. We're also securing funds to help people with rental assistance stay in their homes, and rapid rehousing, doing a lot of that, getting ready to go on that. And then we're in the last stages of finalizing contracts to be able to provide funds for microenterprises in lieu of PPP, and working to just try and keep as many folks afloat as we can.
Thank you. And I know that some of you touched on this as you were answering that, but could you speak a little bit more about how some of your operations have changed during COVID-19? You know, some of you obviously working from home, but any other kind of technologies or other methods for working that you've had to adapt?
One of the ways is the way we provide patient services, you know, the adoption of telehealth. I mean, we know it's always been there, but that's been a big one. You know, it's been a big one. As Bill was saying, you know, we also screen as we come in, you know, the purchasing and providing tents outside to make sure that we're, you know, going through the screening process correctly, you know, because there are a lot of things that come with it, you know, that come with the screening process. We've been able to purchase video conferencing software for our providers for, you know, to be able to provide the services needed to patients, you know, so that's been really important. That's been something that we've had to do. And we've also had to look into, which has been a change, is the expansion of our broadband, you know, here at the center. You know, with these changes come changes within the center as well, you know, so we've had to do that. So those are some of the things that we've looked into.
We've also done that as well, expanding what was already on the March telehealth. It's become a major part of healthcare, even long before COVID, but this situation really kicked it into high gear for most of us, I believe. And so we're doing that as well, making sure that we put the message out into the community to encourage our patients who need to still come in, to not be afraid, to know that we are taking major steps to ensure that our facilities are absolutely 110% clean, the way they need to be all the time, but even more so right now. Making sure we are constantly disinfecting all of our facilities and patient areas, making sure that our staff, you know, even though we're, you know, like somebody like myself who's not frontline medical, but I still work here every single day, making sure that putting on that mask becomes as much a part of our daily to do as putting on our clothes, brushing our teeth, and heading out the door. And that's something we all need to remember to do, take those little steps and have them become an integral part of what we do on a daily basis, so that anytime we come into contact with each other as staff, or with our public, with our clients, our families whom we're trying to take care of, that we pose as little risk to each other as absolutely possible.
We've been dropping plexiglass barriers in the waiting room between different seating arrangements. We've upgraded our filters on our HVAC systems. We've looked at several different redesigns of patient flow so that people are maintaining as much social distance as possible. I think we were up to about 50 Zoom licenses. Never thought we would quite get there. We're beginning to put out a different telemedicine product. That's one that can be used in the home for a Medicare patient or in a subsidiary. We had a number of smaller clinics that we had to close down because we just had so many people who had to work from home. And then you get people that have a family member test positive. We couldn't keep all the clinic sites staffed. So what we've done is to identify a product that allows an MA to check with a stethoscope, an otoscope, a tongue depressor, blood pressure cuff, under the direct supervision of the provider, who's a distance provider, so that we can do a more effective telemedicine encounter than just through a cell phone or a tablet connection. Those are some of the places that we've adapted technologically.
Yeah, so, and I mean, obviously with adapting to technology comes a lot of changes maybe for your staff. And I was wondering if you could talk about, you know, both from a technical skills perspective and just from kind of the human component perspective, what has been the impact on your staff throughout the COVID-19 pandemic?
Well, one of the major impacts is school. We've got a number of staff who have school-age kids. And so we're trying to figure out how to balance our need to have not only their bodies, but their attention when they're trying to get a kid online to do the schoolwork. We're doing some suggestions with our staff and letting people kind of sort it out as they do that. One is the formation of pods where they can rotate through and begin to support each other, either with themselves or with neighbors on school time. Counselors can't really be in a counseling session and then worry about the kid having to get off and do some physical activity. Another is flex scheduling, where we can give people the opportunity to schedule encounter sessions in the evenings or early mornings, somewhere around the school schedule. That's probably our major challenge right now.
I think something that's important that we've focused on, you know, there's a lot to focus on right now, you know, with everything that's going on, is keeping up morale amongst the staff, you know, and making sure that they're okay, that we're meeting their needs, that they're okay emotionally, mentally, you know, even spiritually. And that's something that's been really important to us. We've had, you know, several departments, you know, kick in to help, you know, they need to talk, you know, there's, you know, as Bill was saying, there's a lot of problems, you know, that come with this at home, and then we have to come to work, and then you deal with everything that you see. So it's very important that we make sure that they are okay, you know. So that's something that we do here, is we do, you know, take that time, you know, to walk around, to talk to them, to visit the other sites that we have, you know, just make sure that if there's anything that they need, you know, we're aware of it, and we do our best to help them.
More than anything as well, I think not just supporting each other as colleagues, as coworkers, you know, as fellow agencies on the front line. COVID has understandably been a horrific situation for the entire community and for each of our families and work families as well. But we've been through bad times before, and we probably will again. And, you know, here in our community, I was just speaking on this subject a couple of days ago with a few reporters from the East Coast and reminding them right now, everyone's focus is on COVID. But let's remember that specifically our community here in El Paso, we've not only been under attack health-wise by this disease, but we've also been under attack legislatively, policy-wise. Policies and efforts that have gone straight at the throat of our immigrants, our low-income families, the most vulnerable among us. And that is an attack as well. And that is an affront to our community. And it's a struggle, but it's also something that we're going to grab each other by the hand and hold on to each other and keep moving forward, because there are better days coming and we need to prepare ourselves and be ready for them.
Well, yeah, Estela, so I know you're talking a little bit about looking at the future, and I'm wondering if throughout, you know, this crisis, if you guys have adopted practices or learned anything about your organization's resilience that you're going to continue to use moving forward. I mean, we don't know when this COVID-19 will end, if it will ever truly end, but kind of looking ahead to the future, are there any kind of best practices you're taking away from this situation?
Well, Nora, it's all about taking everything one day at a time. You know, we've been here 50 plus years, not just here in Segundo Barrio, but in El Paso, in our community. You know, por la causa, la lucha. We tell our new staff members that when they come to work with us, it's not just a new job, that they have not just joined an organization, they've joined a social justice movement. And they have to see it that way and realize that they now have a place in an effort that is targeted solely on making the lives of our communities and our families better. A lot of us, I think, have asked ourselves, if I had been around in the early days of the Chicano civil rights movement, of the civil rights movement, I wonder how I could have been a part of it. Well, I think right now, this is your opportunity. This is your chance. Someday, years, decades from now, we're all going to look back and maybe tell our children and our grandchildren what it was like to live through the most horrific health crisis of our time. What it was like to be fearful, understandably, but have the personal gumption and courage to get up in the morning, get dressed, put on your mask, and head out the door, because the people around us are depending on us. And we have to remember that. And we have to remember we all have a job to do. We have health services to provide. We have housing services to provide. We have social services to provide. We need to hold hands. We need to speak calmly and with compassion, and make sure that our community is a little bit less afraid and a little bit more full of inner strength and courage. And remember how our culture gives us strength, how our history and our heritage gives us the fortitude to lift our heads up and say, we can do this.
So I guess for us, part of it is figuring that we're not going back. This is kind of the 9/11 universe, where before that you walked on an airplane, and after that you didn't walk on an airplane. And I don't think we're changing to what we were before. So we're trying to build patterns of, we call distributed responsibility, where folks have a little bit less of a chain of command mentality and more of a collegial decision-making process. We're building that out with our colleagues and other agencies and organizations, doing a lot of collaborative work around homeless issues, around not just the healthcare issues in terms of our primary and behavioral health, but also with substance use disorder, street outreach. How do you do street outreach in this kind of a world? We've been working to try and figure out how we deal with social distancing in emergency shelters. And that's one of the major challenges we see going forward. So this is a reorientation of how we do business. And we need to kind of see that that's the future. So there's a day at a time aspect to it. There's also this is what we are going to be dealing with for a very long time.
So it's important to note that moving forward, as we've been saying, is not looking back, right? Not looking back. And it's a time of recuperation as a whole, to keep moving forward, to keep us, going in the direction that we were going before all of this. I think it's important, very important, to remain, our biggest advocates. That's what we are. That's what we do. Get out there in the community. We have an amazing community. And I know it's been touched on, that our community is our biggest voice, and we need to throw ourselves out there, and show what we do, for our people. And keeping up the prevention. I think that we're learning a lot from this experience that we're going through, and not dropping those best practices that we've already started, keeping them up, testing, prevention, and treatment. Let's just, keep doing what we do, keep doing what we're doing, and making sure that we're taking care of those that come see us 100%.
Well, kind of, again, stepping back from the present and necessarily from health, I know that some of your organizations have other services like educational services or a microloan program. And I was wondering how you guys are planning to adapt some of those moving forward, if you still have them, or if they're going to take a new form in the future.
Digital divide is a major issue. So we've made it so that people can apply, register, and upload documents online. But a lot of our folk don't have that capacity. Um, some don't have the training to do it. Some don't have the access to the internet to do it. And so that's kind of a growth area for us. Um, the microloan program, we partner a lot with Live Fund and People's Fund, and our outreach staff has been on the phone and on Zoom calls since this thing started. But we're watching businesses just disappear, and a number of them don't think they're coming back. So we're we're getting a little bit of money, should be ready by the end of the week or next week, to begin to get out to some of those businesses, but it's too little too late for most of them. So there's going to be a whole rebuilding process, because most of these businesses came from people just doing stuff out of their house. And that'll probably come back, because there is a very strong entrepreneurial commitment in the community. We're also dealing with people really mad at us because of the testing. We can't do it faster than we do it, and they're frustrated. And so there's been a lot of work with our staff on how do you deal with somebody who's just plain mad at you because you can't do what they want. And that's a long-term issue too. So it's one thing to have a community that is scared and is reactive to that fright. And it's another thing to have one that's in the process of healing and recuperation. And how we help bridge that is a challenge for us.
Right now, Nora, we're focusing on healthcare and making sure that our folks are safe, are healthy, and that they are aware of what they can do at home within their own families to remain so, to educate each other and be consistent in their own personal care. There's a lot of, like Bill was saying, there's a lot of misinformation and a tremendous amount of confusion in our community right now, because there has not been a consistent, solid message statewide. And, and I'm talking about it, coming straight down from the governor's office, about everything from how and when we can or shouldn't wear a mask, how and when we can keep our teachers and our children safe in classrooms, how and when, you should prioritize your right to go to a bar or be in a crowd or other high-risk environments over the solid message: stay home and be safe. You can go to a bar any other time. Right now is not the time to do it. Now is not the time to be risking yourself and those that you love. You want to have a nice cold beer, fine, do it at home. But there is no need to put yourself and others at risk. It is too much of a risk. It is deadly. That is not an exaggeration. We've seen that. And so you couple that with the message from the top office in the country telling us that children are immune and that it's not as big of a crisis as people paint the situation. Well, we've got quite a few, 1,000 people that are laying in morgue cabinets right now in our state who would love to be able to testify that that's not the reality. We're losing lives. We're losing people's safety and health. And for the message should be, be safe, stay home, everybody hunker down and do what you can to take care of each other. And instead, the message is convoluted, the message is confusing, and the message is the opposite of what we should be hearing. And so right now, as a healthcare provider organization, we need to go back to square one and take care of our people. And that doesn't just mean health-wise. Right now, El Paso also needs our support for our immigrants in our community, our low income, our uninsured. We're forgetting about them, and that should not be the case, because right now, they are the ones who are most at risk. If you're uninsured in our community, that means you don't have a medical home. That means you don't know where to go for help. That means you're much more likely, especially if you have children at home, that if you start feeling those COVID symptoms, sadly, you're much more likely to stay home wondering what you can or should do, and it may become too late. That shouldn't be happening.
Yeah, I wondered if Estella was going to stay at the state level.
Oh, Bill, you know me.
We're taking food to people because they don't have any vehicles to go get in line at the food bank. The level of capacity to stay home is a challenge because you got to eat. And if you've lost your job and the food stamp snafu hits, you're in trouble. And then there's this crazy individualism. I have a right to go out and do whatever the blank I want to do. And your life means nothing to me as long as I can do what I want to do. And that's been stoked. And that's just disastrous for any kind of community sense. Sorry.
Well, it's okay. Well, I know that Bill, you touched on a little bit ago that the technology divide has proven to be something that your organization is struggling with, and I know maybe some of the other organizations on this call. And you know, with libraries and schools closed, a lot of access to internet and other digital resources is limited. So I was wondering if you could talk a little bit more about how you guys are adapting to that.
You do what you can do on a voice line phone call.
Yeah.
Somebody's 100 feet from the boat and you got a 75-foot rope. Adapting is not really the right word.
Mm-hmm.
So yeah, I mean, we're part of the voice with the Federal Reserve screaming about we've got to deal with digital divide. We've talked about that with the city staff and with the city leadership, that we need to deal with the digital divide. The schools are putting out hotspots, but if anybody's tried to use Verizon in my part of the woods, it doesn't work because you get calls dropped and you got the signal coming over from compatible towers. We are hitting the underlying gaps that were already always there, and they're being made much more visible. The answer in the future is pretty clear. We've got to set some community priorities. We cannot afford to lose the minds we're losing. We need them. And we're not in a position to adapt enough to do what needs to be done by ourselves. It's got to be public policy.
You know, Nora, a lot of people don't realize, or at least don't think of technology in the sense that it is exactly like education. It's power. It is sheer, unadulterated power. And if you don't have access to that, if you are on the wrong side of the digital divide, as Bill said, with a 75 or 50-foot rope, there's no pretty way to say it. You're screwed. You were in a very bad situation, and a lot of folks in our community, even being aware of this community's challenges, will say, oh, well, you know, they should save up and get a computer. Well, good luck being able to do that, first of all, and being able to finally, maybe if you're lucky, afford a used semi-good condition computer. Well, that computer is not going to be any good to you if you can't also access and afford internet access.
Exactly.
And people forget that most homes south of I-10, particularly here in Segundo Barrio, they're very old structures that are made in such a way that Wi-Fi access will not function well as it should, as it's meant to here in our community. You know, I've seen photos of kids back in the day, 30, 40 years ago, hanging out on the corners, you know, watching the sun go down and enjoying each other's company. Well, nowadays, it's not a rarity to drive around Segundo Barrio, South El Paso, and see kids hanging out on the same corners. But this time, they're out there with their phones and their laptops looking desperately for a Wi-Fi signal so they can do their homework.
So a lot of our roads have letters in front of them, FM, farm to market. Those roads were put in to deal with the agricultural collapse around access to market. We need to take the same position that the internet, the digital world, is a highway. And we need to have the farm to market equivalent for everybody.
Nor if I can just add on to that, going back to the idea of technology like education and power, we all have a right to education. It's not a privilege. It is your basic human right to be able to have access to education. Same goes for technology, obviously. Because right now, if you don't have access to technology, you don't have access to healthcare. You don't have access to the information you need to stay safe and healthy. You don't have access to so many other things that are going to ensure the well-being of you and your family. And so in the future, we need to prioritize full, free access to technology for everyone in our community, regardless of their income or status in our
Getting on a
community.
road.
Exactly.
It's amazing to see the numbers. We were looking at our numbers, when it came to our patients, and approximately 20% of our patients don't have access to any kind of broadband services, which creates a huge barrier, and I think we've all seen that. And so, yes, definitely, our priorities do need to take a shift, and we need to see these things. It's very important because regardless of these barriers that are created, us as clinics, as services to the public, we have to do what we have to do to make sure we're meeting, their needs. So that's very important to take a look at. I do agree that our priorities do have to shift, right, and see these important things that we're maybe not seeing.
Well, yeah, just, I don't want to keep you guys for too long, but kind of stepping back to a even more macro view, what are kind of your organization's priorities moving forward? Again, I know for some it's kind of a day at a time, just kind of what you're looking ahead to.
How about Medicaid expansion? We are insane about not doing that in this state. Texas is #1 uninsured. And it's insane not to do that.
And adding to that as well, I think yesterday I was listening to the Texas Standard. Shout out to our friends out in Austin for some excellent news coverage for our state. But I think it's official now. 1 out of every 3 Texans does not have health insurance since COVID broke and became a part of our daily lives. That's beyond tragic. And so I'll agree with Bill there. Medicaid expansion would be a fabulous thing to have, but also a problem that we have consistently historically been facing here in our community, and not much has been done to alleviate it. Our physician shortage. You can snap your fingers and magically give everybody in this city, regardless of their political status in our community, regardless of their income, boom, they've all got medical insurance. Does nobody any good, not a bit of good, because if you don't have the doctors and the nurses and the providers to be able to offer quality, affordable services, it's all for nothing. We need to have physicians, nurses, providers, dentists, psychiatrists, everybody who is trained and qualified to provide culturally and language sensitive services to our community with dignity and respect. That would be ideal.
So a subset on psychiatry. There's a whole statewide initiative to have school residential and fellowship programs in psychiatry train in community settings. The 3 of us are community settings. Nobody's using federally qualified community health centers for that training because they're afraid it wasn't mentioned in the legislation. We've got 2 full-time, 1 part-time child and adolescent psychiatrists on board. We could offer that kind of residential supervision and training. And they're all Texas Tech grads from El Paso. So why not? Why not use us? Why not engage with us? Why not help us be part of the answer on behavioral health when we're dealing with that as part of all of our worlds? We have to do integrated healthcare. That's our mandate. But we don't need to do it in silos.
Well, Layla, I don't know if there was anything you wanted to ask or add on.
Yeah, I did. Thank you all. This has been really, really insightful and I know and helpful for me. And you all touched on a little bit about your workforce and your employees and the impact. There are absolutely multiple things happening that are, just contributing to the crisis, childcare, and adapting to just the crisis. But when you think, and it's hard for us, and I can understand that it's hard for you all to think long term and to think strategically, but what are some of the things that would be helpful to you all for your employees? One thing is adapting to the crisis, and at the same time maybe them also having to learn really quickly some new skills, some new technologies, to wear multiple hats and to cover, and the longer shifts, but different shifts. And so now maybe we're seeing this internally within our organization, that maybe those titles are not necessarily the same. Now people are maybe doing 2 or 3 different types of job functions. And so they're having to adapt that. What are you seeing kind of as like the long-term needs for your employees to be able to do that? And you as an employer, and because you have some limited resources now, what would be the ideal way to help upskill or different skill, maybe not necessarily upskill people, but to get them across multiple skills and learning different things so that they can serve clients differently? What would be some things that if you could help your employees work differently, what would some of those things be?
Social media. We've had a team start up on using Instagram, Snapchat, Twitter, etc. And we have people who are consumers of that, but a scale up in terms of the ability to frame and present information using social media.
Like marketing and communication through that platform, correct? How to reach
marketing, communication, consumer support, client network. We've got one where we've had a healthy cooking class.
Right.
And the healthy cooking class that we've had was running about 20, 30 people. It was how do you do Hispanic food that doesn't lead to higher blood pressure, diabetes, etc.
Okay.
They put that on Facebook and now they've got 400 people.
Wow.
So
okay, very cool.
Learning that shift of how do you present information, also how do you get feedback. So we've got folks doing surveys trying to figure out where people are. Survey design has become integral to a lot of our departments. And then how do you take that data and make sense out of it so that you're not just looking at tons of data that you don't quite know what to do with, tweaking the questions and understanding the answers. So those would be some areas that we've seen across the board in terms of dealing with homeless, dealing with parenting and children, dealing with healthcare, dealing with prevention. All of that needs to run through social media.
Thank you. Really great input.
Estela or Jessica, did you have any?
Somebody mentioned, and I think maybe all of you did, is that you had a telehealth component, and that I've used telehealth before the pandemic. How are you seeing that transition for your staff, but obviously to your clients? But exactly what can you describe what some of those telehealth practices are? The how and what, if you don't mind.
Well, all I can share with you at this point is that depending on the community that service is being targeted at, it is going to be a learning process. For us, many of our clients are not very experienced with technology. And if anything, we appreciate the one-on-one aspect of meeting with a physician, with a provider, of feeling a sense of personal connection. And technology is great and wonderful, but it's really hard to match that through a screen. It's very, very hard to match that through a voice over the phone. And a lot of our folks, just based on conversations that I personally have had, I guess in a pinch, they see it, well, mejor que nada, you know, better than nothing. We're doing it not because we want to, but because we have to under the circumstances. And so you have to face that challenge.
I have to say that we had a pretty good response. You know, that was something that we weren't really anticipating just because of our, you know, our numbers, like I was talking about the percentages earlier. But one of the things that we looked into is also training and teaching our MAs, you know, and how to talk to the patients, because this is something different. You know, a lot of our patients are not aware, you know, or don't know how to use, you know, different types of technology. I mean, that's just the way it is. You know, we have people that we had to walk through, which is what we do. That's why we're here. You know, we're here for that. We're here to walk you through, to, you know, sit on the phone if we have to, step by step. And that was something important, you know, is that you have to start, you know, to implement, you have to teach, you know, and you have to help people understand, you know, the importance of a telehealth session. You know, you have to help people understand that, you know, at this point in time, this is what we have to do for you, you know, for you, most importantly, for the patient, for ourselves as well, you know. So it was nice to see that they took well to it. You know, it worked out, it went well, and so far it's been working out. But yes, I agree, you know, face to face is sometimes a lot better for them, and they'll still come in, you know, they will still come in, and we're here for them, you know, we're here for them, and they come in and they get to see their doctors. But we had a pretty good turnout, which we were really happy to see.
Good.
One of the areas of challenge with that is with dentistry. It's currently illegal in the state of Texas for anybody to look in the mouth and do anything like teledentistry.
Right.
Now you can't, obviously, you know, you can't drill, you can't fill, but our priority right now is on urgent care in dentistry, which is kind of crazy, but the inability of our dentist to tell somebody to poke their phone up against their mouth and look and see if there's a real crisis there, that's a policy issue.
Right. Okay. You know, I attribute the telehealth a lot to banking. I work downtown, and I remember, you know, City Hall and seeing individuals coming to pay their taxes in cold hard cash, you know, because that's just the culture, and we just prefer to do this in person. And the same thing with the banks. You know, you see lines of people wanting to go up to a teller, looking them straight in the face, and having that interaction. But the market just, and the need just shifted, and it became a survival thing. And so, you know, you've got a credit union just on the street that is always full, and there's maybe one live person there at a time, but all of the other stations are virtual and telestations. And you know, individuals that, you know, it's a need. And I think just we're creatures of habit. And so absolutely the first, you know, the first few times it's uncomfortable, you prefer that in-person interaction, but the more and more that we do it, the more trust perhaps that is developed, and the more credibility that it has, and hopefully encourages more people to take advantage of it, even if it is in not the method that you prefer. But if enough people have done it, and if enough people that you know have done it and have benefited from it, hopefully that would encourage more people to take advantage of it and relieve some of that stress on the system, on themselves, you know, getting them access to that healthcare. So
one of the interesting things is that our counselors are telling us that they're having an easier time with the school kids keeping their attention by going through a screen than they did by having them in the office.
Right. Interesting. Yeah.
So
I think
there's a generational component.
that's right.
I smiled when you talked about banking, because I bank with Bank of America, and I was one of the ones that yesterday looked up my account and it was all zeros. I had a kid that I had to get money to, and I couldn't move my money. You get accustomed to stuff.
That's right. Yeah. Right. Okay. Thank you for that input.
Well, anyways, just to kind of close out, if you guys have Any other kind of general comments or advice for other institutions who may be navigating similar situations, either in El Paso or elsewhere around the country? Just anything else you kind of want to add in closing?
I think we've got to reimagine how family is a part of business, and how childcare and being present to family members that need to have somebody in the house has got to become part of our business plan.
I think it's important to seek support within our community. I think here in El Paso, we're very lucky to have an amazing community, an amazing group of people that are willing to help. You know, we've been through so much, and they're willing to help and in every way. So I think that that's something very important, is to look within your community for these resources for people, you know, to lend a helping hand.
I think right now as a community, we are maybe at a different point than we were a few months back when all this was so new and so terrifying. And it was a, how am I going to take care of me and mine mentality? And I think we have begun to shift toward how are we going to take care of each other in our future mentality. So I think it would be nice to see organizations, you know, like the Chamber, lead us all toward gatherings and discussions like this one, not just that are industry focused, but community focused. You know, how can we bring business and, community together as one for solutions and for not just building a better future, but protecting that future.
Well, thank you. Thank you very much for joining us. I really enjoyed this conversation. I learned a lot about the organizations involved. So thank you again for joining us.
Thank you.
Thank you. Thanks to everybody as well for your input. Really,
Thank you.
stay safe, everybody.
Great weekend.
Thanks.
You too. Thank
Bye-bye.
you.
Bye-bye.